everyone, in today's video I will be focusing on the last 4 weeks from the 17th of April up until the 16th of May 2021, and this is for the Covid-19 pandemic in South Africa. As at the 16th of May, South Africa conducted just over 11.1 million tests. The active cases stood at 34,166, and that's a change of 12,046. The recovery rate stood at 96.5%. The active cases scenario from the 1st of March up until the 16th of May 2021 shows the consolidation period over there. And in one of my previous videos I mentioned that this pattern cannot continue forever and that a breakout would happen, and it happened indeed towards the downside, followed by a very short consolidation period, and then followed by the upswing towards the end of April. Here we have the bird's eye view, which shows the sharp decrease in active cases from the second wave, followed by a rather long consolidation period and the upswing towards the end of April. That upswing in April was confirmed by the 7-day moving averages. As you can see, a sharp increase there. This graph is very interesting. It shows the active cases versus COVID-19 testing from the 1st of March up until the 16th of May 2021. For some reason, during the week, which is, as we all know, consists of 7 days, for some reason on Sundays and Mondays fewer tests are being conducted, and an increase in testing is being conducted towards the middle of the week, namely on Wednesdays and Thursdays. It goes without saying that the more tests you conduct, the more chances are that you will find active cases, and an increase in testing has been noticed from the end of April, which resulted in an increase in active cases being recorded. To put that into a better perspective, South Africa's testing is at a very low level, and its testing is also being conducted on a very irregular basis. South Africa conducted just over 11.2 million tests out of a population of nearly 60 million. Austria, on the other hand, conducted testing 4 times its population size. And today, the big question is, are we really in a third wave of coronavirus? Well, my answer is that it's inconclusive. You cannot make a conclusion based on low levels of testing as well as irregular testing patterns. Has South Africa tested at a much more elevated level, as we have seen with Belgium and Portugal and Israel and Austria? This consolidation period over here, which lasted for quite a long time, could easily have been higher if testing was conducted at a much more elevated level. But what is important is to not pay attention to the percentage changes, because that is very misleading. On the 23rd of April, the active cases stood at 19,809. The difference between that and the 16th of May, which showed a figure of 34,166, was a change of 72.48%. It's a very dramatic number. However, the change was only 14,357. The change from the 17th of April compared to the 16th of May shows another dramatic figure of 51.77%. However, the change was only 11,654. So when analyzing data for the COVID-19 pandemic in South Africa, pay as much attention as possible to the numbers itself and less attention to the actual percentage changes. And that's it for today, folks. Whatever you're up to, please continue to adhere to all health regulations as well as lockdown regulations as imposed by the national government. Till next time, South Africa, take care.